Have you been told that you should just wait for your child's baby tooth to fall out? Even though the cavity's big, just leave it in there and just, let it fall out on its own. But if you've ever wondered, like, the tooth's not loose, where is this logic coming from? Then stay tuned to this video. This is for you. Hey, if you're new to me and new to this video, I am Dr. Jasmine Elmore, a board-certified pediatric dentist, breathing, myofunctional, and airway expert. I don't do rushed appointments and I don't cut corners. People want to know how I see what other dentists miss, and so I created this YouTube video for parents to check out inside of my mind, because several of you asked, so you can get an inside look as to how we make sure that your child's dental care is not just good enough, but we make sure that it's precise, personalized, and built for a lifetime of health. Yes, parents strive to see me and my team because here, every detail matters. And that's why they call me Dr. Elmore, AKA Dr. Detail. Every concern is heard, every tooth is examined, and every treatment plan has a solution that is custom to each child and one that lasts. So I don't follow the rules most offices live by, I rewrite them. If you're done settling for, let's call it basic or routine dental care, and you want true, meticulous, science-based pediatric dentistry that we call optimal care here at Optimal Kids, then you're in the right place. Today's video is for all the parents out there who are wondering, do these recommendations really make sense? And are these recommendations really for me? So recently I've been getting quite a few referrals from general dentists or adult dentists. If you don't know what general dentists are typically dentists that have a large range of procedures that they can do. There are multiple specialties in dentistry. We have orthodontics. Most of you are familiar with orthodontics because you're familiar with an orthodontist, who is a dentist who specializes in braces and things like that. We have pediatric dentists, which is what I do, which are dentists who've gone through specialized training to work with children. We have endodontists. They're special dentists that work with root canals. Periodontists, they work with gum disease. So there are specialties. And specialty means that we've gone through additional training, and we should, not all of us, but most of us, reality guys. I'm here for the people. I'm here for you, so I'm always gonna keep it real. Most of us, with the additional training, we've done that for a reason. And how we see things, how we look at things really backs up the additional letters or the additional degrees on the wall. Again, not always. Nothing is all or never, or all or none, but most of us do a pretty good job. Okay, so whenever I get a referral from a general dentist, typically the way the referral should go is for an examination and evaluation of the child, for me to give the parent feedback of my thoughts, and to come up with a treatment plan, and for the parent to then make a decision. Yes, Dr. Elmore, I agree with you. I'd like to move forward with treatment with you, or no, I would like a second opinion. Usually I'm the second opinion. So typically the parent already has heard some information. They're coming to me for a second opinion, and they trust me to give them the real, which is, yes, I agree, I can fix this. Yes, I agree, I can't fix this. No, I don't agree, but I can fix this. Or no, I don't agree, and I can't fix this. So somewhere in those four answers, okay? But for this video specifically, I want to talk about baby teeth that are gonna fall out soon, okay? And soon is gonna come up as a big word. Soon is one of the most vague. It is not one of my favorite words, but it gets thrown around all the time. The tooth is gonna fall out soon. Well, what in the world does soon mean? So typically, well, let's back up for a second. Teeth fall out on a schedule, okay? So there are, with exception, if you get extra teeth or you don't grow teeth or something like that, there are 20 primary teeth. Let me write primary in there. Primary is another word for baby teeth, okay? So there are 20 baby teeth, 10 across the top, 10 across the bottom. Okay, a lot of parents don't realize that around age 6, that's an average. I have seen this start on 4-year-olds, and I have met some 8-year-olds where this process is just starting. But the research tells us around age 6, we get what's called a first permanent molar. And the first permanent molar grows in on its own. It does not replace one of the 20 baby teeth. I think that's a very important thing to point out. Most parents who come into my office are shocked and appalled that their 6-year-old has a new tooth, it's permanent, and a tooth didn't fall out for it to happen. Again, I've seen 4-year-olds with the 6-year molar popping through. I've seen 8-year-olds where it's just barely peeking through. 6 years old being kind of that, just, average age. But the point is, a new tooth grows in on its own. It's the first permanent molar. No baby tooth is lost to gain it. So let's do a little drawing here for a second. It won't be, if you follow this channel, you know it won't be glamorous, but you should be able to follow along. So we've got on the top and the bottom, in the back, oh, almost forgot one, 2 sets of baby or primary molars, okay? Let's do this the way I would do it if we're in the office. So if we're looking at, this is looking at the child's face. So this is the right side, this is the left side, okay? Right, left, okay? Hope you guys are following. We're starting at the back of the mouth. These are the last 2 teeth, top and bottom. In front of those teeth are the ones everybody recognizes. Oh, flip them upside down. The canine teeth, okay? They're pointed, sharp looking, or at least they should be. That's another conversation for another day. Put the top ones upside down. And then in the inside of those canines towards the middle, you've got 1, 2, 3, I should have left more space, 4. 1, 2, 3, 4 incisors, or thin little narrow looking teeth. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 teeth on the top, and 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 teeth on the bottom. Okay, so if we're looking from the nose and we're going out to the sides, those last 2 teeth in the back, those are our baby molars. That canine here in the front, and the orange, and then the blue are our incisors. And the blue teeth fall out most often than not first because they grew in first. Most kids are going to grow the bottom 2 baby teeth and then maybe the top 2 baby teeth, or maybe they get all 4 bottom baby teeth and then they start to get some of the top baby teeth. And then this molar, what we call the first molar, grows in, and there's a space or a gap there. And then the canine teeth grow in. And lastly, those baby or primary second molars grow in. Okay. I hope you guys are following me. If I lost you, leave a comment down in the comments and I can bring it back for you. So back here in the back in black is where I'm going to draw the first permanent molars. Can you appreciate that they grow in back here on their own? They do not replace one of the baby teeth, okay? They grow in on their own, typically around 6 years old. And around the same time frame typically is when a child will say to a parent, I have loose teeth. And typically those teeth that are loose are typically the first 2 baby teeth on the bottom, and their permanent predecessors, their permanent replacements, are starting to grow in around the same time that those permanent teeth in the back are growing in. I hope you guys are following along for me. All right. So if age 6 is typically when these first permanent molars arrive, then when do these other teeth start falling out? We've already talked about the blue ones on the bottom. All right, those blue teeth. And here's the thing, before I keep going. The beauty of it being 2026, the beauty of us having the internet is that there's some things, some information that's so factual, so non-debated, it cannot change. This age is not debated, 6 years old. Now, it's an average of millions of kids, which is why you got some 4 and 5-year-olds who are just getting their first permanent molar, and why you got some 7 and 8-year-olds who are just getting their first permanent molar. It's an average. But that average is not being argued on the Crunchy Mom holistic side of things. That average is not being argued on the traditional, conventional, we believe in nothing different from 1972 to 1772. Everything's the same today. There's no debate about these things, guys, okay? So you can Google when do baby teeth fall out and kind of get a range of when baby teeth should be falling out. Again, I'll say some kids' baby teeth fall out earlier. Some kids, the baby teeth fall out later. Typically, as a guide, if you get your baby teeth early, you lose them early. So most kids are going to get their baby teeth somewhere between 4 to 6 months of age. And again, most likely it's those bottom 2 teeth in the front. My diagram here, they're 2 green permanent teeth. But before that, they were 2 little blue baby teeth. So typically this is the range. So if parents told me, oh yeah, they started cutting their baby tooth right around 4 months, they're most likely gonna lose their baby teeth earlier than somebody who tells me, man, it was like 9 to 12 months before I saw a tooth to peek through. That means we're going to be on the later end of some of the time frames I'm going to go over in a minute. Hope that makes sense. So when do these teeth fall out? Again, these are ranges, but typically these two teeth here start to come in around 6 to 7, those two permanent teeth. Sometimes the two top baby teeth get loose next, or maybe the two baby teeth on the side of those. So we'll just, for the purposes of this diagram, we'll say our kid now has 4 teeth, permanent teeth on the bottom, and 2 permanent teeth peeking up top. Typically, that age range is going to be around 7 years old. Okay. Around the time that we're typically 8, the next 2 teeth that start to get loose are those canine teeth. And what I'm going to do, so I don't have to keep switching colors, is I'm going to just fill those in. That lets us know they're permanent. So those bottom canine teeth start to get loose, and its permanent successor comes on in. That's typically around age 8. And then, oh, sorry guys. Not why you guys didn't say something. We got to get these 2 teeth up top replaced. So we have 4 permanent teeth on the top, 4 permanent teeth on the bottom. That's happening around 7 to 8, around the same time that those canines on the bottom are permanent. Now, when do these baby molars start falling out? Good question. Usually and typically the first one to fall out is the first one to grow in. And do you guys remember the first one that grew in our diaphragm, in our diagram? Okay, good answer. The first primary molars. So those first primary molars start to get loose around late 8 years old, early 9 years old. And we got a theme now of green is permanent, orange filled in is permanent. Let's go with the pinkish color here. Yeah, I'd say pink, magenta. So I'm gonna turn that into a permanent tooth. That's happening around late 8 to 9, okay? Late 8 to 9. Now, this last baby molar, again, falling out somewhere on a range, is typically about a year or so later. Again, some kids sooner, some kids later, but typically about 10 years old. 10, sometimes we make it to 11. And right around the time that those teeth are cutting and coming in, the last teeth that typically fall out are those canines up top. They hang on lasts, and they're usually our 11-year-old teeth. So 11 years old for the canines, somewhere about late 10 on the all 4 molars to come in. Again, this is an average. This is just common knowledge. Every kid's gonna be different. That's why you come to an expert like me or other pediatric dentists where we tell you what to expect. We can tell you the time frame of these teeth, okay? Let's go to the next chapter of this, if you will, which is, okay, let's say, before I eliminate this, let's say that, what color's not gonna confuse you guys? Let's go with purple. Let's say, in the example that you're gonna see when I take you guys to the screen, we're gonna do a Loom video, and I'm gonna show you some actual x-rays because you guys really enjoyed that when I did that in previous videos. But let's say this baby tooth back here, we're calling that the second permanent molar. Excuse me, oh, that's right, this is permanent. My brain was telling us permanent. It was purple before, it's like a purple circle. Let's bring that purple circle back. So this baby molar, okay, the second baby molar, let's say it has a cavity on the back side of it that's really large. And it's sitting next, you can't really appreciate it in this drawing, but teeth sit beside each other. I'll grab a model in a second and show you. But teeth sit beside each other all day long. So if there's a large hole in this back baby molar, what do you do? When do you recommend, or when does a dentist recommend to remove this baby molar? When does the dentist recommend to let the baby molar fall out? And when does the dentist say, let's keep our eye on it? So that's what we're gonna talk about next. Let me go grab the model and I'll be right back. So guys, I'm back. I've got the model. I think you can appreciate now that teeth sit together especially molars in the back all day long. This is why flossing is important. We'll talk about that in another video. We talk about caries risk in one of my other videos. You can click that video right here where it talks about low, moderate, and high caries risk. So check that out. It's about 4 minutes of that video is when we start talking about the caries risk. So check that out if you're interested. But these areas in between, if you're a moderate or high caries risk, caries mean cavities, guys. But if you're a moderate to high caries risk, these surfaces in between, we call these interproximal surfaces, or these in-between surfaces are at high risk, guys, for cavities, which means these surfaces, if you look down, we can't see anything. My vision is only gonna show me these areas of the teeth. We talk more about that in that video I told you to check out, but what's happening between the surface? There are cavities there. And these cavities, we call them kissing lesions. These kissing lesions are because the cavities sit together like this. So if we have a hole on this tooth and it's sitting beside this tooth all day long, then of course, common knowledge tells us that this surface is at risk because there's a big hole on this surface right here. Okay, so if there's a big hole on this primary second molar baby tooth, how do we decide to leave it? How do we decide to watch it? How do we decide to treat it? That's what this video ultimately will be about, okay? So let's get into some more beautiful artwork, people. And let me show you, it's gonna be a lot easier to see as we get into going to the actual x-ray. If you've watched some of my videos where I talk about, I have a video where I talk about treatment planning, you'll be able to see some teeth as well. But for those of you who are trying to educate yourselves and make the best decision, like I always tell parents, everything in dentistry should make sense. This is not rocket science, guys, okay? So, apologize for the drawing in advance, but we're gonna do the best we can, okay? So, the tooth that I'm actually drawing up top up here, this molar, to be anatomically accurate, has 3 roots most often, but anywho, this is a permanent tooth up top. Remember our first permanent molars? This is one of those on the top. And here's one on the bottom. What you see below the surface of bone, these are called the roots. What you see below the surface of bone, these are called the roots, roots, roots. What you see above the surface of bone, these are the crowns of the teeth. Okay, in this case, the natural crowns. Unless we're talking about crowns, I've got a video on that too. Check that video out here. We talk about zirconia crowns versus stainless steel crowns. But unless we have a crown on the tooth, then these are the natural crowns. Okay, so let's talk about our, baby tooth now. So here's our baby tooth. We're gonna sit it beside the permanent tooth. It's gonna have much shorter roots because it is a baby tooth, right? But it also is going to have roots established in bone and a crown above the surface, okay? Hope you guys are following along. If you're not following with me, leave me something in the comments and let me know. I'll slow it down and do it again. So under these baby molars, we're just drawing one right now, there is let's do the permanent teeth all in black here. There's a permanent tooth waiting to come in. What's interesting is teeth are so cool. Teeth grow in with the crown first, and then like a tadpole, the leg kind of follows along later. So as this tooth is more established, as this tooth starts to come up in the mouth and shimmy its way up through the bone and eat away the legs of the baby tooth gets loose, because its legs are gone and it's just a little piece of tooth left now just in the gums, because you can appreciate if this is bone. When you smile, you don't see bone, you see gums. So above all of this bone that you see, guys, where you look at your teeth, you see gums. So, hope I'm not losing you. This is all the pink stuff. This is all the pink stuff that you see when you're looking in the mouth, okay? Pink stuff, those are the gums. Okay, so as this permanent tooth shimmies its way on up and eats those legs away on the baby tooth, then what's left in the gums is just a little piece of baby tooth, and that falls on out. So if we draw that same drawing up top, oh man, drawing upside down is it's fun stuff. I love you guys, okay? I love you guys. I'm doing it for y'all. So, same thing, same thing. Permanent tooth. Not gonna have that much long of a leg right now. As it shimmies its way on down into the mouth and eat those legs of that baby tooth away, it's just a little piece of crown left, which is when the tooth gets loose and falls out, okay? Now, the question of the day, the $1 million question. I'm trying to figure out which color we're gonna do. Let's do blue. If there's a big hole on this baby tooth, how do you determine when to restore or fix or do something with this baby tooth? And how do you determine to restore, to fix, to do something on this permanent tooth? Great, great, great question. And this video, like I tell you every video, is not to bash another dentist. We're all gonna have our opinions. The best way I describe it to parents is dentistry is like a balloon, okay? And you've got inside of that balloon, lots of thoughts. You know, the balloon's this big. You've got thoughts on the outskirts of the balloon, inside over here, inside the balloon over here. You got some people in the middle. You have thoughts. There's a range of thoughts that are considered acceptable knowledge in our dental industry. And then there are things outside of the balloon. And when you land outside of the balloon, you land at risk to get your license snatched up on off that wall in your office, okay? So there's a range of things that are to be accepted. And I try to teach you guys within the range of accepted. But keep in mind, you clicked on Optimal Kids' video, which is Dr. Elmore's video, AKA Dr. Detail, so you're hearing my opinion. So let's not go back and forth about this person's opinion, that person's opinion. You're here for my opinion, right? But I try to give you my opinion based on the fact that I'm board certified, based on the fact that I've been a board examiner, and based on the fact that I try to stick you guys to common knowledge. We're not gonna get into the materials this video to do fillings or crowns, those types of things. But we're gonna focus on cavities because they're universally accepted. And if this, back to this drawing, if this baby tooth has a big hole that if we go to the model here, we're not talking about some little hole out here in the enamel, right? In our remineralization zone where we're gonna want our toothpaste to work, where we're gonna want, check out my other video where I talk about the extras, your mouth breathing, your inflammation, all those things, where all those changes will work and make a real big impact. That's out in the enamel zone. So we're not talking about a cavity and enamel. I'm talking about something in the dentin that's big and headed towards the pulp. That's that red in the inside. And if you look at this one here, it's laying right up into the pulp. That's what we're gonna be talking about when we go to the screen and we go look at some x-rays. So if you have cavities this big, when do you decide, oh no, that big hole has made a mark, an imprint on this tooth? Because now if we move from the baby tooth to the permanent tooth, this is a forever tooth. We want this tooth to remain cavity free ultimately because it's there forever. And so now it's even more vital for us to have an intelligent conversation about what's happening over here on this tooth if there's a big hole. The bigger the hole, what's happening to the tooth beside it, where they're sitting together all day long, touching all day long, okay? So here's what I advise parents on, okay? The more developed, I'm only gonna do this drawing once, so we'll focus on the bottom teeth. But this permanent tooth and this baby tooth relate to each other. Right now on my diagram, I must be thinking about breathing, keep talking about the diagram. This baby tooth has two nice little roots established here in bone, which means if you were to grab it and give it a little jiggle, it's not going anywhere, which means it's going to be in the mouth for a little bit of time. As the permanent tooth that was down here makes its way up and gets closer, it starts eating away, or the term is called resorbing, the roots of the baby tooth above it. So as that permanent tooth makes its way further and further and further up into the mouth, now this baby tooth is starting to get loose, okay? So now here comes our permanent tooth. It's now, remember the leg grows as the tooth comes in, so that's getting longer. Our baby tooth should now start to be what I call dentist loose, because you know, we're heavy-handed. We're like that grandma that puts extra seasoning in all the food. I don't know if you have that in your family, but I know a couple of those grandmas. Not my grandma, shout out to Mama Elmore. She's very health conscious. I have plenty of friends whose grandparents add a little too much seasoning. So think about the dentist with his heavy hand shaking this tooth. Now this tooth is gonna wobble a little bit, okay? Now, as this permanent tooth really starts to make its way up. Now that baby tooth has no legs left, just the crown. This would be a baby tooth that I consider is gonna fall out soon. And there's that word again that I don't love. Soon. Oh my goodness, I'll put a heart around it, but I don't love it. I don't love that word soon because soon is so vague. So how soon will this baby tooth come out? Well, if it's now loose, it depends on the kid. Some kids don't like wiggly teeth and they'll wiggle them out when they're wiggly because it gets on their nerves. Other kids don't like wiggly teeth and therefore they're babying it, they're barely brushing it, they're eating on the other side. It's like the tooth is royalty and it's being held up on a pedestal or a pillow. So it depends on the kid. It depends on the child. But with no roots, this tooth I would consider falling out, there's that word again, soon. But typically what I tell parents, if I'm looking at this scenario where there's only just the crown left, no roots, this tooth will be out soon, 3 months or less. With a really good wiggler, a month or less. With somebody kind of afraid to wiggle, they bite down into hard things, it's gonna be jingling and jangling and wobbling and bobbling, okay? Now, hope I haven't lost you guys yet. Now, let's go back in time to where we were before, where this baby tooth had established roots. Let's say this permanent tooth is right here. Oh, don't worry about that big cavity, Mom, Dad. That tooth's gonna fall out soon. Well, it's got too long established roots in the bone. What definition of soon? 2 years? Does that seem soon enough for you? I mean, soonish, I guess. Let's be a little less dramatic. Let's say this one. How soon is that tooth gonna fall out? First thing I would do as parent, give it a wiggle. If it's excessively loose, it's falling out soon. If it's a little loose, it's soon-ish. Soonish is the term that I would say. Soonish, 12 months. If it's wobbly when you wiggle it, then 3 to 6 months. Okay. If it's like falling out, they put their tongue on it. Kids do that all the time. Kids love to push them with their tongue. We're talking a few weeks, maybe a few days. We're not talking these time frames. But I'm talking about a tooth that you had no idea is loose. The child's not reporting is loose. The child doesn't seem to have any issues with it at all. And we look and we see legs still established in bone. Legs still established in bone, not wobbly. 12 months, guys, soonish. And listen, if you can make a baby and the time that we're talking about watching the tooth is not soon. It's not soon. Soon for me and soon for most of the parents because I polled my parents. I asked my parents, what's soon? What would you say is soon? What's your expectations when a dentist tells you a tooth's gonna fall out soon? And then you know what most people told me? 3 months. 3 months or less. I asked parents if they thought 9 months was an appropriate time for soon. They said no. And of course, anything over 12 months, they kind of thought I was crazy. But I hope you guys can appreciate, all the fun aside, that if there is bone on a baby tooth under the bone of the jaws, and the tooth is not loose when you as mom and dad wiggle it, it's going to be in the mouth for a few months. Now, if you're actively wiggling it, jiggling it, giving it extra motivation to come out at home, that's another thing. But most parents are not actively wiggling the teeth, especially when a dentist has told them it's gonna fall out soon. It's gonna fall out soon, so why do we need to put any extra effort into it falling out? That makes no sense. So I hope this makes sense to you guys. Now we're gonna go over to the computer and I'm gonna show you actual x-rays to show you what happens when we're told a tooth's gonna fall out soon and we don't make a decision on what we're gonna do with the baby tooth. But first, I just thought about it. So what do you do with the baby tooth? Well, let's say there's a small cavity past the enamel into the dentin a little bit, just into the dentin, and it's sitting right up against that permanent tooth. Here's what I personally recommend. We fix the baby tooth's filling, here cavity with a filling, so that we can see with direct eyeballs what's happening on the surface of this tooth we need to keep forever. That's very, very, very important. And if when we look on the surface of the tooth, we start to see some breakdown, but no hole, some demineralization. What can we do with demineralization? Demineralization. We can mineralize. When there is a soft enamel breakdown happening, that's where our toothpaste and fixing the extras, like I've talked about in other videos, will help strengthen the enamel of the permanent tooth and not necessarily be an indication for restorative work. Now, once we take a direct view onto that surface and we see a cavitation, a conversation needs to be had about restoring that cavitation before it grows. If it's an early cavitation, maybe we're still talking about remineralization, but we don't want to be foolish enough to not let the science and the research and clinical understanding tell us that once there's a hole, repair of that hole is difficult. Okay, repair of that hole is not impossible, but it's extremely difficult. And if we have a hole that we're even talking about getting that far, are we really brushing consistently? Are we really flossing consistently? Have we really committed to fixing the extras? Your mouth breathing, your inflammation, or are we just getting by and surviving? Because sometimes as parents, that's what you have to do. I talked to a mom today who has 3 kids under 5, and I told her, kudos to you because I know you're busy. Thanks for our time to even have this conversation today. But the point is, most of the times parents, especially if they have multiple children, are in survival mode. So we got to be real. We have to be realistic. We have to have expectations. We got to make sure we're all on the same page. We don't want to have regrets. And so if we're talking about a small into dentin hole on permanent tooth, then what we would typically do is fix the baby tooth, because that's going to fall out soonish, right? So we can do a fill in there while we can get a good view. If we see starting demineralization, we'll remineralize it. If we see progressed breakdown of the tooth, we fill it. Now, we don't want to see this on a permanent tooth because, guys, we've been talking so far about kids up to what age? 10 to 11 on a tooth that needs to be in the mouth till what? 90? We don't want to have a big hole that needs to be repaired that's headed towards the nerve. We don't want a big hole that's into the nerve. Now we got to get into the crunchy debate about root canal, no root canal, and all of these different things when we could have avoided this completely by fixing things early on. We want to be proactive, preferably, and not reactive. But if we are going to be reactive, we want to be smartly reactive, and we want to react in a way that's more conservative. And the most conservative approach is not to watch and wait and watch a hole to grow. The conservative approach is to fix when it's small and fix everything that led to that thing and make those changes so that we are in a place where things can calm down. Whether that be salivary testing and looking at that and putting a customized approach to that. That's kind of controversial right now in this age group, happening a lot in the adult age group, and other things that I won't talk about in this video. But we need a plan. So when the hole is big on the baby tooth that's sitting up against the permanent tooth, which is the permanent tooth we need forever and ever and ever and ever, and we're 10 years old and we're having a 90x view to 90 years old, guess that's 90x, 9x, you guys understand what I'm saying, a future view to the permanent tooth, we need to figure out what we're gonna do, okay? And again, my go-to is if it's not loose to the parent, if it's not loose to the child, then the tooth's not falling out soon, it's falling out soon-ish, and we need to do something about it. Be it fill the baby tooth, be it big filling the baby tooth. Typically, we don't crown a baby tooth if it doesn't have 2 long established legs, typically. There's always exceptions, but typically, if the legs are missing, we don't crown. We would just do a big filling and risk, you know, I tell the parent, listen, the filling's really big. We know why we're putting a big filling, but we risk some chomping and that big filling fall out. But we're being more conservative versus a crown on a baby tooth we know you're not gonna have for 2 years. And then when the cavity's into the nerve, we need to most likely remove and get that baby tooth out of the way, allow our permanent tooth to come in, but more importantly, we're not allowing day after day after day after day of breakdown from this baby tooth to happen on the surface of the permanent tooth beside it. Hope you guys follow me there. So now, finally, let's go to the computer. You'll see my head on a much smaller screen in a minute, and let's talk about some actual x-rays so you can see this process a little easier than my creative artistic drawing. So see you in a sec. It's come to my attention that you might have had some glare, so I'm just zooming in so you can clearly see what we're talking about when we're talking about the permanent tooth and the roots there. So that's easy to view. Our soon versus our soonish and some of the things we were talking about. Zooming in so that you guys can really see the drawings and really see what's going on before we move to the next slide. So hopefully you guys are following along with that example. Let's talk about a couple of things. Now, this patient in particular is 11 and a half, okay? And the reason I mention that is because with the example we just gave, look at how many baby teeth are still in the mouth, and we're 11 and a half. So let me get you guys situated and acclimated with everything we got going on because there's so much, okay? Let's start right up here. Back here is a permanent tooth. Here's a baby tooth. Here's a permanent tooth. Here's a permanent tooth. There's a baby tooth, and its permanent tooth is up there. This is so far off the screen and cut off. Let's just ignore that. So if you go back to our cartoon that we had, this is our first permanent molar. Remember, it grew in on its own, probably not around 6 for this kid, maybe a little later. This is the second primary or baby molar. There should be a first in front of it, except we're so advanced in age, it's gone. There's a permanent tooth there. This is the baby canine I told you guys typically falls out about 11. This is an 11 and a half year old, but you can see its baby or primary canine here and its permanent tooth pushing it out. They zoomed in a little more for us up here, if you look right here, so it's even clearer to see permanent tooth, permanent tooth, permanent tooth, and then there's that baby tooth. Now, do you guys see a leg or roots here? No, you shouldn't. You'll just see the crown or the top part of the tooth. The permanent tooth is right under it. This is a tooth that I would tell a parent is falling out soon. Absolutely. This tooth should be loose, and this tooth should fall out soon. Now, let's define soon. On a super wiggler, a few days to a week or so. On a not so into the wiggling wiggler, maybe a month. Again, those are guesses, estimates. I mean, this tooth can hang on for 6 months. Who knows? But it doesn't have legs, so it shouldn't be in too long. What may be easier to see here on this screen is that there's a pretty big size hole here on this baby tooth. And based on the size of the hole, if you guys can appreciate how I'm circling the hole here with my mouse, that based on the size of that hole, there's also a hole on this side of the tooth as well that's much smaller. So here's the size of that hole. Here's the size of this hole. When this baby tooth falls out, I would expect to see some breakdown starting on this permanent tooth and a lot of breakdown here, maybe even a hole here. I'm going to see for a second if you have epilepsy, light sensitive, skip past the next 30 seconds, but I'm going to invert, which means I'm going to try to change the picture view here so that you guys can appreciate a little bit better how large the hole is. Here it is over here too. The way x-rays work, light passes through when there's a hole. That's why this entire area here is light, because it's air. It's the kid's mouth. And then the nerve you see in the tooth, more air or light can show through, then the more ossified or boniness or calcified bone of the tooth, the dentin, and then the enamel. So you can see what those things look like. But I think you can appreciate, even online, that there is a pretty big white size thing going on here. Excuse me. And a white size thing going on here. And if you're really particular with your eyeballs, which that's my job, doctor detail, you can appreciate that there's some breakdown that has started on the permanent tooth. This one, debatable, but this one looks like we've got that breakdown starting. Okay, let's go back to the regular screen for those of our friends whose eyes don't like that. Okay, now that was the right side of the mouth. Let's go to their x-ray that they have up here on the left side of the mouth. So again, permanent tooth, first permanent molar, permanent tooth, premolar, permanent tooth, baby tooth, canine. Okay, so here's our primary second molar, primary second baby molar. It has a pretty good size hole here, a pretty good size hole here. And if I had to compare this baby tooth and this baby tooth, can you guys appreciate that this baby tooth would fall out most likely before this baby tooth, because it has a little bit of leg there. There's the bone. See the bone? Can't really see the bone there, but you can see the bone there. See how it's got a little something to hang it into the bone there? Where up here, you can't even see the bone at all because the bone's down there. This permanent tooth we're in the gums. We're in the gums up here, guys. Bone's down there. You can't even see it. This baby tooth's going to fall out soon. It's just in gums. This baby tooth, soonish. This is one I'd give a wiggle and see if it's wiggly. Now this side of it, lower leg than this side of it, is it wiggly? Maybe. Probably a little loose is where the kid would describe it. This tooth's a little loose. This tooth is very loose. When I bite down, it moves. This tooth right here, this is the same tooth. This tooth moves when I bite down. This tooth may be a little wiggly now that you mention it. Okay. And if we invert, caution again, we're going to invert, guys. So pause and skip forward if you don't like the inverting. If we invert, can you appreciate how large the breakdown is there, how large the breakdown is here, and how it is impacting the permanent teeth that it's sitting beside? Okay. I want to point out too that it's not our job to wait until there are radiographic changes for us to act. And by our, of course, I mean the dentist. Because in order for there to be changes so grotesque enough for you to be able to see on an x-ray, severe demineralization of the enamel or the dentin has to have had occurred for you to be able to view it on an x-ray. So if there's just some surface breakdown or surface cavitation or hole, it may not be viewable on an x-ray, but that may be the perfect time to fix it before we approach the nerve, before we approach just having a really big filling that's going to be difficult to sustain chewing and functioning over time. I really hope that makes sense, guys. And that's a very, very, very important point for parents to understand. Okay. Let's go down to the bottom left area now. Okay, so down here, let me get my head out the way. Can I get my head out the way? Can I get my head out the way? Here we go. Let's get my head out the way so you guys can see. Okay, here we are down here. So permanent tooth here, permanent tooth down here, permanent tooth down here. Hard to say with this x-ray, right? Not the best view. From experience, I'll tell you this is most likely a permanent tooth, but it's difficult to tell, right? You need a clinical exam and a better radiographic exam to confirm that. Let's focus on these three teeth right here. Permanent tooth, baby tooth, baby tooth. Okay. Now, can you guys appreciate the difference in this second primary molar between this second primary molar and this, or this same tooth, second primary molar? Falling out soon, falling out soon-ish, not falling out anytime soon, because look at the legs established in the bone. Can you guys see that? So this kid, I want you to appreciate, we got a big hole here. We've got a big hole here. It looks like into the nerve of that tooth. And then this permanent tooth behind it, let's invert. Caution those for the inverting. Let's invert so you can see. Can you appreciate that here's our enamel? That's the darkest gray. Here's our dentin, the lightest gray. And then the almost white here, the beige is the pulp. Can you see there's a hole? Look how the light's passing down into the dentin. I mean, here it's pretty clear that's pretty much into the nerve there. There's some light under that filling on this baby tooth as well. And if we focus on these two teeth, this is considered, in my world, a pretty sizable hole on the permanent tooth. Placing a filling here means the filling's going to have a hard time lasting long. You got to floss, you got to brush, you got to change the extras so that the filling placed lasts. Because a filling, especially a white filling, no matter what material we're using, be it ceramic, which is what we use here, which tends to be more biocompatible, whole nother video on that, versus a traditional composite. Doesn't matter what the material is, but the point being, it must be maintained. It's like buying a car and never changing the oil. You have to change the oil or you'll be on the side of the road, whether you're in a Porsche or Rivian with the fanciest car in the world. You've got to change the oil. Fillings require maintenance. But this is not a small filling, guys. X-rays are distorted by 30%. Just like on your side view mirror, objects are closer than they appear. Same type of thing with x-rays. Holes are closer than they appear. This is 30% bigger in the mouth when we go in there, okay? So very interesting. I'm gonna make one more comment before I say what I'm gonna say, but let me move my head again. And let's go over here. So down here, you can see permanent tooth, baby tooth, permanent tooth, permanent tooth, baby tooth, permanent tooth, a little piece of permanent tooth. And then what is this? Permanent tooth, baby tooth. We need a clinical exam and probably a better radiographic exam to confirm. But let's focus again on the two molars. First primary molar, second primary molar. How do we know that? Shorter legs here than here. So this came in first, is leaving first. This came in second, it leaves second, okay? Now, it's off the view. This is not a good x-ray. We can't see the roots. We need to be able to see, look, we need to be able to see what's called the periapical area around the apex of the tooth. So we can see how long does this tooth need to be in the mouth, because guys, let's invert. And again, caution those on the invert. Holy cow, we are big, bad, and into the nerve here. So some breakdown has started. We probably can see with our eyes, given there's a space here. When this kid is in the office, we can see breakdown on this permanent tooth already. But we need to know, how long is this baby tooth going to be in the mouth? Soon? I don't know. Let's invert again. This soon? Absolutely. Do you see legs? No. You don't see legs, just crown. This is loose. This is a tooth the kid's going to say is loose. Now this one, we need an x-ray. We need to be able to see the legs. We don't know. But if it's kind of like these two, there's bone, see that? Draw the bone across, bone covering it. It's not falling out soon. It's a soonish and established. Now, why is this important? Why am I so passionate about it? Why did I do this video? Because this kid was referred to me to fix this permanent tooth right here, this one over here that has a hole, and this permanent tooth over here that, with a clinical exam, which I don't have the benefit of right now, has a hole. The exact words from the referring dentist was, we're watching the baby teeth to fall out. Now, watching this baby tooth with the big hole, same tooth. Let's do this one. This baby tooth with the big hole, sure. I mean, it's loose. Remember, it's soon. It's going to fall out. This baby tooth, kind of need a clinical exam. Kind of need to wiggle it. Kind of need to see how wiggly it is, because it's got a big hole. Smaller hole there, different situation. Pretty big hole here, right? Not once was this baby tooth, or this baby tooth, which is probably gonna fall out, or the permanent teeth. Remember guys, the holes, let's invert again. The hole sitting right up beside the permanent tooth. Not once was that on the referral to talk about. Oh, and this one up here, forgot. Hole right here sitting on the permanent tooth. Let's invert again. Hole sitting on the permanent tooth. Hole sitting on the permanent tooth. So let me go back, because there's so much here that I forgot the summary. This baby tooth that soon has a big hole here and a hole there. So we are at risk. This surface here, this surface is at risk. This tooth here, soon-ish, we need to wiggle it, see if it's super wiggly, it fits more in the soon category. If it's not wiggly, most likely in the soon-ish category. Big hole here, medium-ish hole here. So this surface is at risk of the permanent tooth, and this surface of the permanent tooth is at risk. You can already gain an appreciation based on looking at the bottom, because on the bottom, referring dentist has already told me there's a hole in the permanent teeth, and you guys can see that as well as I can. And there's a hole, we can't really see this clearly here, but referring dentist is telling me there are holes on these two permanent teeth. But this baby tooth is not falling out soon, guys. I can guarantee you that. And so what are we telling the parent? What's the plan? Most likely this tooth needs to be removed because the hole is pretty big. It looks like it's in the nerve. Maybe a smaller hole we'd consider filling. But this bad boy is big. We need to get this tooth out. We do not want to cause an infection. We do not want to continue to have, let's say I did what the dentist told me to do. I didn't think for myself. And I filled this permanent tooth right here. Well, the entire time I filled this permanent tooth and then wait for this baby tooth to fall out, all of that decay, guess what it's doing, guys? Eating a hole again right up against the tooth that it ate a hole on to begin with. You can tell by the size of the cavity here, it's been in the mouth longer than this tooth over here. So if we don't fix this and we fix this, what do you think is going to happen to what we fixed in the time frame of this falling out? Probably a new hole. And so I'm just so passionate about this stuff, guys. Size matters. I took some notes to summarize. Size matters. A small early cavity behaves differently than a large one. And location matters. These cavities between the teeth wouldn't be discovered without x-rays. And on a scale from 1 to 10, these x-rays are like a 6. They need improvement. These aren't the best x-rays. If you're curious about x-rays, check out my video where I break down why quality x-rays matter, why they mean so much. So they're not the best x-rays, but based on what we can see and the information we can conclude, these are not areas that can be watched clinically with eyeballs, which means these would need x-rays to track. And now we're talking about doing more x-rays, but they got to be tracked. And then teeth fall out based on a time frame that varies per child. That depends on when you got your first tooth. You guys now know some of the most frequent ages, but this kid is 11 and a half. This is more of a mouth that I'd expect on maybe a 9.5 or 10-year-old. So the kid's a little late. No big deal on being late, but big deal on the fact that general dentists or whoever, not picking on the general dentist, again, this is not about judging a dentist. This is about the people. This is about you, the mom, you, the dad, you, the grandma, you, the aunt, you, the neighbor, you, the whoever who cares about the child that you love and want to make sure things are done right. Okay. So the bottom line is that this tooth here is not falling out soon, or maybe we need to define soon. Maybe for this dentist, 18 months is soon. But for most people, that's not their expectation of soon. Okay. And symptoms. Pain isn't always the first symptom. I didn't talk about this, but my note says sensitivity. Sometimes a tooth is cold sensitive, so kids will avoid drinking cold water. They drink room temperature water. They won't eat ice cream. Food packing, so food getting wedged down into the holes, that's a symptom, a really big symptom. Big amounts of food should not have to be toothpicked out of teeth. Bad breath is another symptom. Doesn't have to be related to teeth. Could be related to tonsils. Could be related to something else. But I think in this case, for this kid, excuse me, given the size of the holes, it's a possibility. And behavioral changes. I mean, I bet you this tooth the child may not be able to articulate pain, but man, the hole is big. It's right in the nerve. This side over here, good grief. Let's invert again. Guys, the hole is impacting the nerve in multiple teeth. Kids got to be feeling something. Sleep most likely is disrupted, possibly schooling and education. I mean, let's look at what PubMed says. I got some notes for you. We know that cavities start with bacteria and acid. We know that. But untreated cavities are a global disease, guys. It affects quality of life. 55% of children with untreated cavities had difficulty eating. 40% had trouble eating. 27% were self-conscious about smiling. Pain, discomfort, limitations vary. Depends on how in tune a child is with himself or herself and how they sense what's happening in their body. But discomfort comes in many forms. PubMed says that severe dental decay in young children isn't just about mouth pain. It's about poor nutrition because chewing hurts. So chewing changes. Kids tell me all the time, I don't know, because I eat on this side. So chewing changes. Sleep is disturbed. Kids can be irritable. Weight can be impacted. Growth can be impacted as well. Excuse me. In adults, I got this stuff from PubMed, so you guys would get some research here. PubMed says that untreated dental caries increase your risk of death. Adults with untreated caries had a 26% higher risk of all-cause mortality and a 48% higher risk of heart disease mortality. And if these are things we know in adults, that no, cavities don't directly cause heart attacks. No, cavities don't directly cause these things, but there is strong correlation. So if we know that with adults, what's happening to our children where we leave untreated decay for what? In the name of holistic dentistry? Holistic dentistry does not mean leave the holes to rot the teeth out. That's not what that means. We'll get into a video on what holistic and wellness dentistry means to me, but I think we all can agree that choosing not to treat cavities on teeth that are not loose is not the best thing for the children involved. Okay, guys? I think that's some of the statistics here. I got other statistics about oral bacteria and the bloodstream and systemic inflammation. You guys can Google search dental infections and see how dental infections impact the bloodstream. Kids and adults die every single day from dental infection. Infections on the bottom teeth can spread to the heart. Infections on the top teeth can spread to the brain. Dental infections are real. I get calls on my emergency line all the time for kids who have dental abscesses. And most times they can be resolved with a prescription antibiotic, but a lot of the parents who watch these videos don't like antibiotics. So let's be proactive. We can't say we're about wellness if we aren't proactive. Let's be proactive. Let's be wellness focused, which means let's not let cavities get so big. We have this decision happening between how close are we to infection before the tooth falls out, right? How close are we to pain and the kid not being able to focus in school before the tooth falls out? So let's summarize this, guys. Okay. When a dentist says, we'll watch it, what should you ask? Is the tooth loose? How long do you anticipate the tooth being in the mouth? And now, after watching this video, I hope it would make my heart proud if you guys would have the ability to look at the x-ray and determine that this baby tooth is going to fall out a lot sooner than this baby tooth. If you can at least leave with that, I'm a proud mama. Okay. So if your dentist is watching the baby tooth, age is one thing, but look at the information. Look at the real information and let that guide you. And watching should never mean no follow-up, no timeline, and no criteria for when to intervene. Otherwise, you're not watching, you're just letting stuff blow up. Watching means active watch. Watching of a cavity means I'll see you in 3 months, not the 6 months your insurance covers, 3 months, because we know the progression of tooth changes. And 3 months makes more sense for a high cavities risk individual than 6 months because we're actively watching. It doesn't mean we're taking an x-ray every 3 months. We've got transillumination we can use. We have other diagnostics we can use other than just x-ray. But it does mean that we are actively watching, not, see it next cleaning. No, we're watching. There's a follow-up involved. There's a timeline involved. I'll see you in 3 months. And criteria for when we intervene. If the tooth hurts, if the gums look swollen, if food gets wedged, kid starts complaining, something's changing, we need to intervene. We need to intervene. We can't continue to wait for the baby tooth to fall out. We need to remove the baby tooth. And the permanent tooth underneath will come in much sooner because now the bone above it is gone and all those things. So it'll be something you won't have to worry about once we take care of it. All this conversation about cavitations and all that, those are permanent teeth, guys. We're talking about wisdom teeth. We're talking about a different thing than these baby teeth. So don't let cavitation stand in the way or be in your thought process on getting a baby tooth that's going to cause a problem out, okay? So situations where watching makes sense. Let's talk about that. We talked about it. Very small cavities, things we're remineralizing, cavities in the enamel, teeth that are loose. Doesn't make sense to take out a baby tooth that's already loose unless it's hurting or there's some reason. But for cavities, it's loose, let it fall out. It's small. You have excellent care. You're brushing, you're flossing, your diet is great. Your extras are under control. You're not mouth breathing. There's no inflammation. All these positive things happening. We're low caries risk, as we talked about before. There's low, moderate, and high. If you're low cavity risk and the tooth is loose and the cavity is small and the home care is excellent and the extras are non-existent, let the tooth fall out and leave it. Don't let one of us try to tell you it needs to come out so that we can get your money. Don't do that. Those are situations where leaving a baby tooth is reasonable. But when cavities are large, when they're close to the nerve, when the roots are firmly established in bone, when the tooth is not loose, we are risking pain. We are risking infection. We are risking emergency visits. We are risking treatment that is now much more involved than it could have been. A filling is much less involved than extraction of a baby tooth, but an infection is way more involved than an extraction. So we need to make sure that we're doing the right thing. It's not about being aggressive, but it's not about being passive. And I think so many parents get caught up on overtreatment because you guys can be prone to sexy information. And I get it because I've been there before. I've been the person prone to sexy information. I'm not some saint. I've been where you've been. I've believed the things that you've believed. We were taught in school that if a kid had a lip tie, tell the parent, just wait till they're playing in the playground one day, they'll bump the lip, rip the tissue, and they'll be fine. I cannot believe I was telling parents with the sense that I have, let the kid face plant, and that'll be a solution to a lip tie. But back then you go to school, you got the degree, you spend the money, you've got the training, you teach, you repeat what you're taught. And I didn't use my brain. This is about thinking and using your brain. Okay. So no, face planting is not a good solution or scenario, a solve all. Yeah. Just wait till they fall on their face. In the same way, this is not about being aggressive. This is not about being passive. This is about doing exactly what treatment needs to be done on an individual basis in a custom way for each child and teen that comes into our offices. That's what this is about. So this isn't about criticizing any providers. I have parents on all range of emotions when they come in, from disbelief to, I made this up because their dentist told them these teeth are going to fall out, even though they know the tooth's not loose. Their dentist told them the tooth's going to fall out soon. disbelief to anger to, my God, this makes sense. I knew that tooth wasn't going to fall out soon. It's not loose, pissed. Anger to sadness, feeling misled. I've seen it all. I've seen the whole gamut of emotions. My job is to do my job. My job is to be supportive. My job is to be a truth teller. My job is to tell you when I'm wrong. My job is to be right more than I'm wrong. And my job is to be an advocate for the child in my chair. And what I want to do with these YouTube videos is educate you, the parents that want these deep dives, the parents that want to understand. I'm not trying to take you to dental school. I'm not trying to make you a dentist. What I am trying to do is have you understand that everything we do should have a logic behind it. Everything we do should have a reason. If we're watching a tooth, we should be watching the tooth. And you as parents should be able to follow along with the logic of what we're watching. And so if you've been told to just watch a cavity on a baby tooth and you're unsure if that plan really fits, ask for clarity. Ask for clarity. And if you want my help understanding recommendations before things escalate, we have some ways coming up where you may be able to make that happen. We're going to work on a school group for parents where you guys can chat with me. Now, legally, if I'm not your child's dentist, I won't be able to give you advice directly to your kid, but we can talk in general terms and general scenarios. These x-rays here, this is on a test patient. These are real x-rays of a patient that was just referred to my office, but you guys don't know this patient from Billy Bob John on the street. And so we have ways that I may be able to take some x-rays and things from you guys and do a group video, redact the name, and do similar things to this. So we're putting that in the works. But I hope this video was so helpful. Please let me know in the comments. If it wasn't helpful, let me know. I'll stop doing videos like this. But on the previous videos that I did, I received a lot of feedback on Instagram that it was very helpful to you guys. So let me know. I won't know if you don't let me know. Leave comments here under the YouTube video and also leave me DMs on Instagram. I appreciate you guys. You guys are like family. When I started this channel, I had no idea that even though I didn't post a video in a few months, that it would grow already and that we get so many views. So I do this for you guys. I do it for the people. I'm glad that you guys are loving it. And I will see you in the next video. This is Dr. Jasmine Elmore, aka Dr. Detail, signing off. And I'll see you in the next video. Bye, guys.